The COVID-19 pandemic has brought up the attention for the sudden loss of smell in the early stages of the infection, which can progress to a persistent olfactory dysfunction. These long-lasting olfactory disorders are a neural deficit presenting the conditions called long COVID or post-COVID conditions, configuring a clinical challenge due to the lack of etiological data, therapeutic methods, and inaccurate or late diagnosis. Olfactory disorders can reduce or distort the olfactory primary skills during both orthonasal and the retronasal olfaction, and they can present themselves as symptoms resulting from different etiologies, having a significant impact on affective interactions and quality of life of people affected with this long-term condition. Preliminary data in different populations shows that this long-term condition can occur from 5 up to 13% of the infected individuals with COVID-19 that developed olfactory disorder symptoms. In this context, the olfactory training, a method that has been researched and documented since 2009 that proposes repetitive exposures to 4 different odorants from 2 to 4 times a day during a few months, suggests a new possibility of clinical intervention in olfactory disorders of different etiologies, including the post-COVID-19. The aim of this treatment would be to stimulate and promote improvements in the olfactory function and perception associated with the regeneration and the neuroplasticity of the olfactory neural pathways, both because of the hypothesis that the repetitive exposure to an odorant could help to modulate the regenerative capacity of olfactory cells and functional changes in the olfactory system. However, as the olfactory training consists in long-term sessions that at least 4 months, this might be a fatiguing process, so treatment adherence is a common issue. Based on the neurobiological evidence that the olfactory perceptions tends to be emotionally influenced, and also the hypothesis that the overlap between neurobiological structures from olfactory, affective, and memory system could reinforce the top-down modulations sought during the olfactory training at the cortical areas from the olfactory system that are damaged after a long-term disorder post-COVID-19, we propose a new concept of olfactory training based on individual's biography and higher balance to the odorant set choosing for the training. In our study, 62 patients with a long-term olfactory disorder post-COVID-19, aged 18 to 65 years old, enrolled in a 3-month olfactory training randomly grouped into standard, the control group, or personalized training with daily sessions of exposure to a set with 4 odorants. In order to assess the regaining function, we applied the UPSIT smell identification test, as well as the assessment of affective memories, valence, and judgments of the odorants from each set by using visual analog scales in 4 monthly sessions, starting with an initial evaluation before the training. Additionally, we assessed the patient's quality of life and emotional status using the Huckel Brief questionnaire and also the Beck Depression Inventory in the first and last sessions only. As this is an ongoing project, we expect to compare and evaluate the rates of improvement of basic olfactory functions in both standard and personalized training groups, and the possibility of mapping those functions gained in an affective perspective. Our preliminary results show that adherence to treatment in the standard and in the personalized groups are suggestively different. Based on our patients' loss rates, we believe the higher adherence rates to the personalized group might be related to better overall improvements of participants undergoing the personalized olfactory training. Also, raw data point to important difference between standard and our personalized olfactory training, with the better results reached with our new protocol. Final stages of data analysis might confirm that we successfully developed a new protocol for olfactory rehabilitation with the addition of some variables that could influence these results, as age, duration of the disorders, and emotional status. This research was approved by the Ethics Committee and has been developed by me, Vanessa Castelo Branco Pereira, master student at the Experimental Psychology Department from the Postgraduation Program from the Psychology Institute at the University of São Paulo, with the advising from Dr. Mirella Gualtieri. Financial support for this research was provided from CAPES ProEx for the material acquisition and a master fellowship from CAPES. Givaldão do Brasil also supported this project, providing with the odorant material.